Welcome to PHAEYDE Clinic.
I am curious to find out what causes hair loss in women.
Female hair loss is a much more complicated matter than male pattern baldness. In the case of women, there can be many underlying causes, which means that a thorough examination is necessary before beginning hair implantation procedures. This examination may actually shed light on the cause. It may be that apart from heredity and aging, similarly to men, hormones may be to blame, especially around the time of menopause when women experience an increase of testosterone production in the body. Pregnancy and childbirth can also often cause a woman's hair to fall out, as can too frequent hairdressers' treatments and too frequent use of products such as hair dyes, especially if these are low quality. Physical or mental stress may also be a cause behind hair loss, as can poor diet, hypothyroidism, autoimmune illnesses and blood pressure problems.
What does female hair loss look like?
Unlike male baldness, female hair loss does not result in loss of all the person's hair on the top of their head, and it comes in different patterns as well. In women, the hair thins out mostly uniformly all over the scalp, and does not begin from a whirl but from the middle of the top of the head or the parting, and there are no bald spots either. Women's hair loss is mostly characterized by diffuse alopecia, the rate of which is determined by the Ludwig scale. Female pattern baldness, a specific kind of hair loss, may also occur as a result of androgenic alopecia.
What can I do if I feel my forehead is too high, and I would like it to be smaller? That is, I would like a lower hairline.
In this case, we do not need to cut the hair in the target area, only possibly on the intermittent and overlapping zones. This sort of hair implantation happens almost without exception in a zero area. There is no hair on the target area. The top of the forehead, that is. The doctors working at our clinic make sure to create a natural-looking female hairline and style, as well as to ensure the appropriate density of the hair transplants. Naturally, we will always discuss the hairline with you, the client, so you can be completely satisfied with the results.
Is it possible to implant among long hair? If it is, how?
Naturally, the procedure can be done without cutting the long hair in the implantation area. This makes the procedure a little more complicated, as the doctor will have a slightly more difficult time with it. However, the donor area will have to be cut in every case. This is about 50 to 90 square centimeters. This is where we will obtain the grafts from. This does not cause any trouble in the case of long-haired patients, as this area can be covered with the longer locks of hair above. We must mention all the limitations that we have when implanting among long hair. However, long hair does have its advantages. For instance, the more budget-friendly FUE is almost always sufficient, as the hair will cover all residual scarring. However, the needle used for our award-winning SHE method has the advantage of leaving virtually no scarring on the scalp.
Thank you for the information.
If you would like to see similar content, subscribe. We hope to see you soon at PHAEYDE, Hair Transplantation Clinic.